You're listening to Grown and Growing with Sonia Hamlin. What's up, everybody? Yes, this is a bonus episode. I dropped 2 episodes in one day. You can thank me later. But if you listen to episode, which is entitled Returning the Favor with Kelli Witt, then you heard her story about how she is taking care of her elderly mother in addition to all of her other responsibilities. In her story, she talked about her decision to put her mom in an assisted living facility. And I wanted to delve a little bit deeper into that decision. So today I'm talking to an expert in that field. I'm talking to Kelli Fields, who is an executive director at an assisted living facility here in Maryland. I wanted to ask her what people should be considering if they are thinking about assisted living for themselves or for their parents. So let's get into this episode. I hope you find it as helpful as I did. So today we have Kelli Fields, who is an expert when it comes to assisted living facilities, here to be our expert today to answer a couple of questions about assisted living. Now, if you are listening to these episodes in order, this bonus episode dropped at the same time as an episode called Returning the Favor, where I talked to a close friend about her experience in taking care of her mom and who has Alzheimer's. And in one aspect of Kelli's story, she talks about the journey of trying to get her mom into an assisted living facility, which specifically is called memory care. So today we're talking to Kelli to get more information on what that is and how we can navigate that journey when it's time. The way I look at it is from 2 perspectives. One is because, I'm over 40, retirement is closer than I care to admit sometimes. We're getting closer to that time where we need to start thinking about life after work or what happens if we get sick. So I'm looking at it from that perspective, but I'm also looking at it from the perspective of taking care of my own parents who are not in this situation yet, but I imagine it may come up sometime in the future. So you're kind of looking at it from 2 perspectives. If you're over 40, or even if you're in your 30s, you may be in a situation where you are taking care of your own family with your own minor children and also taking care of your parents, which they call that the sandwich generation. And so Kelli's here today to just kind of walk us through, provide us with information. It's not everything you need to know, right? Because I think in retirement age, you not only have to think about your healthcare, but you have to think about healthcare, housing, income, and basically how you're going to take care of yourself. But this is one huge aspect of that journey that a lot of people see as an obstacle because the lack of affordable housing and healthcare for older or disabled adults is lacking in the U.S. So that is a challenge for most people. So we're going to talk to Kelli today. And the first question I'm going to ask you, Kelli, and thank you for joining. Thank you for joining us. The first question I'm going to ask you is the difference between assisted living and a skilled nursing home. So what's the difference between those two?
Okay. Well, a lot of people, when they think about assisted living and they're thinking about a skilled nursing home, they kind of lump them into one group. So most people kind of have that perception of everything's going to be like a nursing home, which, is more sterile environment and that type of thing. But the things to look at in terms of differences within assisted living, what we're focusing on is taking care of your activities of daily living. So if someone needs assistance with dressing, grooming, bathing, some of those basic care needs. And also if someone is in need of memory care, as you mentioned with your friend. So someone who, is beyond the mild cognitive impairment, they have dementia where they need to be in a more secured environment where there's more one-to-one attention in terms of being able to watch over them and to be able to assist them with still maintaining some independence. but also there to kind of guide them through, you know, the assistance that they need with their activities of daily living. When you look at a nursing home, nursing homes are providing more of a skilled service. So someone who needs a wound treatment, or someone who needs, you know, maybe feeding tubes. So in an assisted living, many times, you know, there's certain things that, you know, are outside of the scope of our practice of what we're able to do. So in a lot of cases, you know, someone may be in an assisted living community, something will happen, which will then make them have to then be discharged to a hospital for a certain period of time. And from there, they might need skilled services before they can return back to the assisted living, because most states will have certain regulatory requirements. Meaning if someone were to move into an assisted living community, they couldn't have a wound, and that's kind of like a skin tear that would need, you know, proper, you know, attention, those types of things. So when you're thinking about assisted living, we can pretty much do everything that's needed in terms of meeting the needs of somebody, from, you know, again, helping them with making sure that they have their meals, making sure that if, you know, they come in and maybe they have a lot of independence and just are there because they want to have someone helping them with doing laundry and keeping their apartments clean, and being able to engage in activities and those types of things. But should they need more assistance over time, they'll be in an environment already where they're not looking to have to then move somewhere else, because moving is already kind of a daunting experience. So you want to be able to find a place in which you can kind of age in place.
Okay. So from my understanding, so assisted living is really living almost in a apartment. It's more closely to how you would live at home, except
Right.
you have help. So you can
Yes.
have your own kitchen, you can have your own space to continue to live your life. But there are also added benefits, like you can meet with other residents, and there are group activities, and maybe there's transportation to your doctor and your doctor's appointments. And then a nursing home is you have a specific health issue. You mentioned wounds, but maybe if you just had a stroke and you're just getting over it. So a nursing home sometimes can be temporary, and
Yes.
the assisted living is permanent.
Yes. Mm-hmm. Mm-hmm.
Okay. Thank you for it, because I didn't know that. Thanks for explaining that.
Mm-hmm.
So when is the right time to start looking for an assisted living facility? So Kelli, you know, had determined that because her mom was sick, so those were the cues to her, like her memory was getting, her memory issues were progressing. It was more difficult to leave her mom at home without assistance. She has her own family, they have their own activities, and she's away from home a lot because of that. And so she felt like she couldn't leave her mom at home. So that was a cue for her to start. What are some other good times for people to start considering assisted living?
Well, one of the things that we find that happens most often is people wait until it's almost too late. They wait until they're in a crisis mode, and that makes the journey of, you know, having a loved one transition into a community more difficult, because there's already that high level of stress and there's that urgency. So you really should start thinking about it when you're well, you know. So if, you know, as an adult daughter, you know, you have aging parents, you know, you want to start talking about those things early on. Talk about, you know, what are your plans should you need some assistance, you know, later on down the line. A lot of times, you know, it could be just a matter of taking an adult parent to an activity that's going on in an assisted living community, or allowing them to have lunch there, or, you know, to have dinner, or to participate in one of the clubs or activities that's going on. So they're already introduced, you know, to the idea of it. You know, if someone starts off and they have mild cognitive impairment, one of the things that we have to understand that over time, that there's going to continue to be a decline. So you want to think about that before it's too late. You don't want to think about, you know, now, you know, my loved one has some cognitive issues that are going on, but I can wait because maybe she forgets some things on certain days, but on other days, you know, she seems to be okay. You know, you don't want to be in a situation where there are some safety issues. Also, you know, when you want to look at physical limitations, you know, you don't want to find yourself in a position where, you know, mom has had, you know, some falls, or, you know, her gait isn't very steady. and then you're waiting until she actually has a fall and ends up with a hip fracture, which is going to, cause even, more needs. You want to be able to start thinking about those things in advance. So they're already in an environment that's safe. They're already in an environment that they can kind of just, age in place. So as their needs change, they're already in an environment that's going to be, safe and be beneficial and can continue to keep them, stimulated from a cognitive standpoint as well.
Mm-hmm. Yeah, it's a lot to unpack there, because that requires having really difficult conversations before there is a crisis. And I know, in even talking to my own mom, I'm like,
Mm-hmm.
what do you want to do? I mean, it's just a hard, awkward conversation to have, because
Right.
you're talking about sometime in the future that is coming, but you don't really want to think about. It seems negative, but I
Mm-hmm.
think if you look at it as a positive and as a continuation of life, then maybe
Right.
it's not so difficult. But
Right.
I'll try that with my mom and see how it works.
Yes.
Um, but do people come to visit? Like, I find that's an interesting idea, because with, when you not look, these are two totally different things, right? And
Yes.
parents aren't kids. But when you take your kid to daycare, you visit different daycares. You
Mm-hmm.
may, visit during the day, and then you see how the kids are. You may sit there for a little bit, ask all the questions. So it makes sense that if you're going to be living somewhere, in a communal setting that's supposed to be, communal, and, you get multiple benefits from being there, you want to visit it ahead of time.
Absolutely.
So
Mm-hmm.
what age do people move into assisted living? Like, can you move before you have a healthcare issue, or just because you just like don't want to live alone anymore? Can you do that with assisted living?
Absolutely. We experience, people roughly from around age 60 and up.
Mhm.
And, that's what I think people, they have this mindset that, it only has to be when, I'm, bed bound or, something of that nature. And it's really, that's not the case, because if you think about it, when someone moves into an assisted living, for many people, you look at it as, I've worked hard, all of these years. Now it's time for me to, reap the benefits of having someone to provide me with the assistance I need. So being able to have meals prepared, because, as you age, those are things that become challenging. They're challenging for me in my 40s, cooking every
Right
day.
now.
So
Right.
being able to have someone that's going to provide 3 meals a day, knowing that there are different activities that I can become involved in. Sometimes we'll have situations where we have, one person that moves in with their spouse, and they're not in need of as much assistance, but it's just become overwhelming them for them to be able to take care of their loved one. So maybe they're living in the assisted living side of the community, but then they have a loved one that's in the memory care side, so that they're able to still be able to visit, their spouse whenever they like, but then they're able to still, maintain some independence, and they're able to still, thrive, because there are things that they can get involved in as well. So that's why we really say, don't wait until that there's this need, you want to be thinking about it earlier on. So, that's why visiting places, if you can't get a parent to go out to visit, I still think as an adult child, it's important for you to visit different communities that are in the area to
Mhm.
find out, what are the things that they offer. So when it comes that time, you've already done some research, and it doesn't feel so overwhelming.
So, okay, so one of the things you mentioned was, there's an assisted living side, and then a memory care side, I assume on one property, so that, if
Mhm.
you're married and one person is in memory care and one person can be in assisted living and visit. So what are
Mhm.
some other options that come with an assisted living facility? Like, how do you determine what's the best option for you, and what are some amenities that you
Mhm.
look for?
You really have to kind of determine what your needs are, because no two assisted living communities are the same. They're all going to offer something different. So that's why I say it's really important to start doing your research and investigating, kind of early on, to determine what would be the best match for me. So determining what, someone likes, what they dislike, the community that I work for, I'm the executive director of Arbor Terrace Senior Living, and we're located in Gambles, Maryland. And one of the things that we offer that's unique is that we have assisted living, then we have a Bridges neighborhood is what we call it. And that's for residents that have mild cognitive impairment. And then we have a memory care neighborhood, which is a secured environment. So there's three different levels that, while you are in the community, you can kind of just age in place. And then there's, services that will meet your needs wherever you are, at the time that you transition into the community. So you want to find out, what the communities, offer. You might have a mom that, loves bridge. So you're going to look for, a community that offers, a lot of engagement, activities. But like I said, every community is going to be different. So you're really looking at what's going to be, most important. Is it the physical limitations that my loved one has? What are the things that they're doing to, prevent falls and things like that? Or if it's more so from a social situation, because my mom used to be a social butterfly, now she's alone. So, you really have to look at, what's going to meet the needs of your loved ones when you're making those decisions. Don't always just look at, because the community has this beautiful appearance, because, you walk into the community I work in, yes, it's beautiful, but at the same time, I can say we have the services that, back it up as well. So it's really important to, do that research. Right. Take the time and spend time there, because if you have a facility that's not allowing you to, spend time there, that would be a red flag. But if you have someone that's welcoming you in, allowing you to have a meal, allowing you to participate in things that are going on, you really get a chance to kind of see the life of the community.
Mm-hmm. Yeah, and I think it's great that you broke it down into different categories, like for whatever you're dealing with. So if you want more of a social aspect, so maybe you're okay physically and mentally, you're sharp, but you want more social activities. Or if you have, physical limitations for whatever reason, but you're still mentally sharp, there's something for that. And then if you have, you're facing cognitive issues, going down the line, degenerative, sorry, can't say that. Then maybe there's something there for you too. You mentioned red flags. So what are some other red flags? So if somebody doesn't want you to stay, they're trying to prevent you from spending a lot of time there before you make your decision. What are some other red flags that you would say?
You want to be able to go in the community and know that the staff are going to be engaged with the residents. If you don't see that, that's something that should be of concern. If you go in and the staff members aren't welcoming, they're not speaking to you, as you're touring the community, that's something that's also, a red flag. In most communities, you will be able to kind of, see the caregivers interact with the residents while you're there. And, there was one family member that I was working with, and one of the reasons why they said that they chose the community that they did is because they overheard one of the caregivers speaking to someone as if it was their, own loved one. And so you want to be able to see that. You want to be able to see that people are really taking their time with seniors, not rushing them along. If, they're in the hallway or they're saying, I need help with this, or they're repeating things, you want to be able to see how the staff members respond to those types of things. Also, it's very important, like if you go into a community, and like I said, they're not willing to offer opportunities for you to participate in things that are going on, I would say that that would be a red flag as well. You want to be in a community that's going to be, very transparent with you and really allow you to get a feel for, what the community offers. You want to be able to ask questions about, their recent surveys, and be able to have, candid conversations about, if there were any citations or anything like that, because sometimes there naturally will be, but, you want to be able to know what the community has done to implement a plan, to correct any issues that have going on in the community. You want to be able to know that, if you go to make a visit and you're not able to talk to maybe the person who's deemed as like the director of nursing, generally they're called like the resident care director. You want to make sure that, there's people there that you can talk to outside of just that salesperson. Because while the salesperson, generally, is an expert in the field, you really want to talk to the people that are going to have that, one-to-one attention, with your loved one. So
Right.
anytime you're not being given the opportunity to, have those conversations, communicate with all the people, that are working in the community, I would say that would be another red flag.
Right. And yeah, because if you, I think another thing is support. Like, what kind of support are you getting? The salesperson is there to sell you on the place, but you
Right.
really want to talk to the people who are going to be interacting with you and your loved one on a day-to-day basis.
Absolutely.
Okay. So, okay, when it comes to, first of all, I mean, assisted living, nursing home, I feel like, when most people think of it, they think of it as a threat. Like, all right, mom, you keep acting up. Shady Pines is in your
Yes.
like, like that's where you're gonna be. But we really shouldn't think of it like that way, because number one, it doesn't have to be that experience, right? I mean, from what you described, it doesn't have to be that experience. So what are some misconceptions of assisted living care from like a child perspective, an adult child perspective, and also from a senior perspective? Like, what do you hear most?
I think with seniors, they're just really surprised, when they go in and find it's like a home-like environment. I think that they still have the mindset that it's going to be a sterile, environment where people are kind of just slumped over, in wheelchairs, and there's not much going on. The food isn't good. So I think from a senior's perspective, generally they have this idea that it's just this morbid pet place that they would be,
Right.
moving into. And I think from the adult child standpoint, for a lot of them, they're going to the community and, they're looking at, all the bells and whistles. But sometimes it's not just about the bells and whistles. Though this community has this pool and, they have this exercise room. But you really need to make sure when you're identifying, a community, that it matches the needs of your actual, parents. Do your parents swim now? That might be something that's appealing to us as the adult child, but we really need to think about what's going to appeal to, the actual senior that would be moving into the community.
Mm-hmm. Okay, so this sounds great. Like you mentioned a pool, which I was like, wow, okay.
Mm-hmm.
So I need to upgrade how I've been thinking about assisted living for sure. But it sounds great. It sounds great to have a place where you can grow old and have all of the support system there to have as you grow old. But it also sounds really expensive. And so how do people generally pay for assisted living?
Well, assisted living is private pay. So I didn't reference earlier on when we were talking about the differences between assisted living and, nursing care. That's another major difference. Assisted living is private pay. So, a lot of
Meaning
people,
you're paying out of pocket.
Yes. So it's not where, insurance is going to cover the cost. Unless you've done things like you have long-term care insurance. So there's long-term care insurance policies that will, supplement some of the cost. And then also, you need to think about if you or your spouse was an active member in the military, there are resources for you as well. And that's why, again, I say you need to start early because, when you are applying for some of those benefits, it's not an overnight process. So you want to start that process, earlier on. You don't want to wait till there's a need to start, investigating in how I can apply for, some of those, benefits that are there for those that have been, actively involved in the military. So there are some resources like that. Like I said, there's veterans benefits, there's long-term care insurance, but you do have to understand that this is something that is, private pay. So it's not where, I have Medicare or I have, a different private insurance that's going to cover the cost of the services. Many people look at, selling their home, things of that nature to be able to, supplement and be able to pay for the costs of the care.
Right. And so I'm sure it varies based on the facility that you're looking at, but do you consider what your household costs now, and how much more is it to live in assisted living than to, like, how should you calculate what the price is going to be like compared to how you're living outside of assisted living?
Right. Because, a lot of times people will think when they, find out, what the monthly cost is, they'll think, wow, that's, really high. But then you do have to keep in mind, all of your meals will be provided for you. And, in addition to that, there are going to be snacks. You're not paying utilities anymore. Those things are going to be all included. Being able to be provided with transportation in many communities to your medical appointments. So you wouldn't necessarily need to, have a car or, the expense of paying for gas. That's something that's included. Most communities will include cable TV, they'll include internet services. So that's another, expense that you wouldn't be required to pay if you were in a home setting. So all of those things need to be taken into consideration. But when you're looking to, find a community that's going to be, from an affordability standpoint, the right fit, some of the smaller, group home type settings that are still licensed as assisted living communities will generally be more affordable than some of, the larger, communities. So
What's
it's a
a
lot to think about.
how is that different than what an assisted living?
So with the more group home type settings, they're generally maybe in an actual house, and there might be maybe 6 beds or, maybe 8 beds. So it's a smaller environment. There's generally, less staff in a situation like that, but there's still enough staff that are able to meet the needs of your loved one. They're still regulated. So they're still inspected. They still have to have a nurse that, comes in, every 45 days to ensure that, the needs are being met, of the residents. So, from an affordability standpoint, definitely, a smaller group home type of setting is going to be, more affordable than some of the larger, communities. And they all, like I said, no two assisted livings are the same. Some of them, everything is kind of bundled together. It's all inclusive. Others, there's, a la carte type of fees for care. So, you really have to kind of investigate and do your due diligence and start planning ahead. Mm-hmm.
So I think this conversation is so great, and I wanted to have it because I know it's not something like, look, we're in our early 40s. It's not something that we're really thinking about now, but it's something that we really should be thinking about.
Mm-hmm.
And maybe it's not something that we can do for our parents if it is cost prohibitive, but maybe it's something you can do for yourself if you start thinking about it now. Actually, when I saw on LinkedIn a couple of days ago, this article that came out from the Washington Post it came out April 4th, and it's about the cost of caring for aging parents and sick spouses. It says, the title of the article is "Caring for Aging Parents and Sick Spouses is Keeping Millions Out of Work." And it says 4 times as many Americans are out of work taking care of adult family members than those who stopped working to care for children during the pandemic. So, a lot of people are out of the workforce, and what typically happens, and mostly to women, right? It is the woman who has to quit her job to stay home to take care of loved ones, is that you make this sacrifice to take care of your loved one. And maybe that wasn't your intention. Maybe that's not something you always plan to do. And so it's a detour in your life. So I think, having these conversations early on so that you know what your options are super important. So thank you so much for coming on and talking to us about it. Is there anything else you want to say about assisted living that you think people should know?
Again, I'll just reiterate, don't wait until there's a crisis or, an urgent need. Start the conversations now, begin, visiting communities. You can, visit 2 years before there's an actual need, but start doing those things earlier on, because it can be a very overwhelming experience. So the more that you learn, the more that you're doing your research, the more that you're planning, the easier it will be to kind of navigate through the process, because it is a journey, and you don't want it to be something, you want to make sure that people are feeling like they're spending their final days, make those their best days. It doesn't mean that it has to be something that's negative. So make the most of those days.
So I should have asked this earlier, but how long do people stay in this? Like you could stay in assisted living for, if you go in at 65, you could live for a really long time after that. So you can be in assisted living for a really long time.
Yes. And that's why, planning from a financial standpoint, kind of exploring what all of your, options are, it's going to be very important, because I know when I first started off in the industry, people were moving their loved ones in and they were expecting that their parent would be there 5 to 6 years, and, people are living longer. So it's, 10 years later and they're thinking
Right.
about, what am I going to do if I exhaust those, resources? But always be open to having conversations as well, because there might come a time that you have someone that's living in a community, and then you realize that from a financial standpoint, I don't know how much longer mom will be able to stay here. But by having the conversations with the executive directors early on, then you can come up with some type of a plan, so that they're able to still meet the needs of your loved one.
They offer scholarships.
That's a good idea.
I don't know. Can my mom write an essay? No.
Right. I mean, you never know. 10 years, 20 years from now, that might be the way to go.
I'll move my mom into the metaverse. Get ready, mom. No, thank you so much, Kelli, for joining me. You provided a lot of good information, and I know this is going to help someone out there. So thank you so much for joining me.
Thank you for having me.
No problem.